Well, hello, John. It's so lovely to see you again.
Hi, Naomi. It's wonderful to see you too. How are you doing?
I'm doing really well, and I'm very excited that you're coming all the way back down under again in October into Melbourne, the 18th of 19th of October. So thank you for accepting that invitation. And there are a lot of people who are really looking forward to it. And what I'd like to do today in this conversation is just to give people a little bit of an idea of what they might expect over the 2 days. So, like in this training, John, you're going to be addressing some of the most challenging therapeutic issues that can arise with abuse and trauma survivors. Things like, self-injury, substance abuse, anger, very angry clients, and oftentimes that anger being directed towards the therapist, and also at times sexualized behavior. And we can understand these, behaviors as, reenactments, as clients being sort of like triggered. And that's sort of like grist for the mill in therapy. But we also need to be mindful as therapists that they can elicit very strong counter transference responses. And sometimes people can feel that in the moment, those feelings that arise, their reactions that arise in response to clients' behavior can be very sort of like challenging and difficult to manage. And I think also can generate at times feelings of shame within the therapist around what's coming up for them. So I've got a few questions that I'd like to ask you about these different aspects of the kind of therapy issues that can arise, and just see, give us a bit of a taste of, how you're going to lead us through understanding these reactions and responses. So I'm going to start with self-injury, if that's okay. And what we know is that self-injury and suicidality are different, but they can also coexist. And they are behaviours that often create a great deal of anxiety and fear in therapists. So my question around this is, how can we manage our own anxiety so it doesn't get in the way of good therapeutic practice?
So, there's two sort of answers. One would be techniques, and we can talk about that soon. But the bigger issue, which I know you share with me, a philosophical notion, is that we're all bozos on the same bus here trying to do the best we can. We all have trauma histories. We all have difficulties. One of us has been elected to be a therapist, and one of us has been elected to be a client, although the best therapists also are clients as well. Uh, and I think that the biggest protection that we can develop as clinicians, I would say this after a number of years of spending a lot of time in these very intense environments, is to change our own cognitive understanding of what the client's doing, why they're doing it, where they're coming from, and what their goal is. Because what we tend to do is react to them as if they're less than us. Well, we don't want to do that as clinicians, but we certainly react as if they have a diagnosis, they're a patient, they've got symptoms, there's something wrong with them. Uh, and that medical model has helped in some ways, but it really gets in the way of empathy and compassion because compassion really, which is a lot of what this workshop will be about, but not in lofty ways, but in real grounded ways. Compassion is about knowing that someone's suffering and wanting to do something about it, but you have to be aware of what they're really up against in order to be compassionate. And we've talked about this before, but the basic notion is that the client in front of you who's being severely, quote, borderline or, quote, narcissistic or whatever they might be, are just stuck in sort of a deterministic world where their childhood histories and their trauma have made them, and their attachment patterns have made them respond in certain kinds of ways pretty much out of their control. And they look pathological to us, but they're not actually at all. I would submit to you that any of us, you and I, or anyone watching this, were the conditions right, we would act just exactly the same as our clients. It's just a question of what the conditions are, what it takes to unfold. For us, well, maybe I've known you a long time, you're healthier than I am, but for us, a trigger is probably going to be moderately impactful. It's going to produce some effects, but we're probably not going to start screaming and rocking back and forth in the therapy chair. But it's the same dynamic, and you know, we ignore that dynamic at our peril if we just use it, if we just try to pretend like we're fine, and I'm not having no friggin' countertransference, and or as you alluded to, I'm a bad therapist because I'm having a negative reaction right now. That you can't fix that, and that, I guess that's where my Buddhist training and mindfulness training comes into the notion that basically there's no way to deal with this stuff but through awareness and kindness to yourself, and using whatever skills you can do to keep yourself balanced. But certainly to understand the countertransference is just the same thing as it's intrusive thoughts. It's stuff based on early on in life. Usually countertransference, as we clinicians use it, is using technical countertransference terminology to explain what is actually just we're not completely healed and we have childhood trauma and we are going to get triggered. I mean, I don't know if I mentioned this, but it's kind of weird. It's like if an alien were to ask you what you do for a living, you'd say, well, I find really very hurt people have lots of relational difficulties. They go, yes, that sounds very serious. Yes, and then what I do is I sit in the room with them. Yes, and then what happens? No, 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 that's it. It's, isn't it kind of bizarre in a way? So, but we of course we do much more, but we do that through mindful attention and compassion and appreciation of the shared experience between us and the client. And although I teach diagnosis and I've written books on, Lord forbid, on diagnosis, stuff like that, I think that gets us into a bad frame if we start seeing our 3 o'clock client as a borderline. We've immediately now set it up on some level for lack of empathic attunement. But the other thing is that, the Dalai Lama has said this: if you want to be happy, practice compassion. If you want other people to be happy, practice compassion. The very same thing that works for your work with a client will work for you. I guess the other thing is just having worked so many years I've worked in torture and sex trafficking, but I have to say, and other things like that, and a lot of combat stuff, but I have to say that in some ways, childhood trauma, as boring as it's almost seeming to be in the professional world now, it's like giving something more interesting. Actually, sexual abuse, psychological neglect are about the worst things you can do to any human being. And what it's the net, I mean, there are many other horrible things, unfortunately, as we can see in the media, but these things are so severe that it just means that both of us are injured on some level, but neither one of us is responsible for an injury, and neither one of us should be ashamed of it. And it's not even bad to be injured. That's like saying, I hurt my left arm, I must suck. Those things don't necessarily follow. And it doesn't mean that you then say, well, I'm just the same as my client, so I get to freak out just like they are, et cetera, et cetera. No, there's a huge amount of preparation we can do, work we can do. And we'll talk about these things, about how we can set our expectations, our understandings. I recommend, by the way, I don't know if I'll mention it later, because sometimes in my work, I've had to see one bad thing after another in very rapid succession, or walk into rooms where different clinicians are working with people, is to set your intentions for like a minute or so, just to go, okay, here I am. This is pretty arousing. I'm still pretty upset about the last patient, or, I really want to go home. I have a headache, whatever. And to kind of ground yourself for a minute, and then just to kind of remind yourself, mindfulness in the Pali language actually means reminding yourself.